Hello, everybody. This is Dr. Jerry Bailey with Lakeside Holistic Health. Dr. Pell and I recently started running these Dutch tests from Precision Analyticals that you can see there. And what this is a dried urine to test complete hormones. So it takes our salivary testing we were doing and that 24-hour urine test that we did to really check your full complete hormone panel, minus thyroid, and it combined it into one simple test, which is using strips, 5 different strips to urinate on. Evening time, just before bed, during the night if you get up, morning, and then 2 hours after getting up. So it saves a lot of time and effort on your portion to do this test. It's really simple of just urinating on the strips, letting them dry, and then sending them in. So it makes it real easy. It takes that place of that ZRT test, what we used to do, which is the salivary test, and then it takes place of the Meridian Valley 24-hour urine collection, which was 2 complicated tests that were fairly expensive. This, in combination, this one really gets it down to an affordable level that covers all those bases that we need to see, and then we can decide what to do from there for you. So this, I took some little pictures of my sample that I did, and it was interesting to see because about a year ago I did my own ZRT test to see where I was, and actually it wasn't too bad. Just a little bit of what's the term I'm looking for, of the cortisol issue for me. My curve was pretty good, but it was a little bit flat. But other than that, the hormones looked good on there. So when we look at the Dutch test here, your results are kind of on this dial, as you can see there. It's how to read that graphical representation for each thing is, if it's a dial, it's on the left side, it's on the low limit. If it's on the right side, it's at the high limit. We kind of want it in between there, kind of in the center. So on mine, when we first looked, we looked at the sex hormones itself, kind of the total estrogens versus testosterone. My testosterone was pretty good for my age bracket, right about 41 there for the level that it measured. But my estrogen was near off the chart. So I had high estrogen production and normal testosterone production there. So then it becomes, well, why do I have high estrogen levels? And I looked back at myself and kind of said, okay, no matter what I do, I'm pretty active, I eat really well, I take my supplements, do all these things, but I have a hard time losing body fat. I do CrossFit 3 times a week. I do triathlon training the rest of the time. So I'm a pretty active person. I wouldn't say I'm super, super active, but I'm well above average for an active person. And I relatively stayed the same weight no matter what I did. When I trained for Ironman 2 years ago I basically took my body size and it just shrunk down. It stayed pretty much the same with percentage of body fat and everything else, but I never really lost my small tummy that I have. My muscle mass stayed about the same, but it just kind of like I went from puffy to smaller. And everybody had noticed that too. So I was like, well, this could explain why that occurred there, as I potentially have some issues with estrogen overproduction there. And then we also looked at, and during this test too, it looks at cortisol levels also. So you can see my cortisol curve there on that bottom side is within range, looks pretty darn good. A little bit low maybe in the afternoon, but not a big deal. My total, so that's how we look at that curve, just like we did before with the salivary testing there. So my daily free cortisol pattern looks really good. The total DHEA production is pretty darn good at 2,800. My total free cortisol is actually pretty good. That's the amount of cortisol in your blood, 128. However, the cortisol metabolism I was off the chart. So that higher level of 700, that 700 saying is your level 10, I'm at like level 15 here. It is cranked way above. So I'm burning through cortisol like crazy and metabolizing it like crazy. I'm being able to keep up, but for some reason my body's going through it. And this has come up before with other athletes, and what I speculate is going on is just because of the amount of work we're doing, we're burning through it a lot. So I decided to do a couple things to help with this too. But you can see that normally I should be about 128 there for that total free cortisol, that first dial there in that adrenal hormones. And then to the right as it breaks down, it should be between 3,800 and 7,000. So if I'm at 128, I would expect to be kind of that third or fourth notch kind of in the center there, probably about 5,000 units for that cortisol metabolism. But as you can see, I am off the chart here. But it makes sense with the amount of work I do. Another athlete here in the area had this done. His was the exact same way. Total free cortisol looked good. That metabolized cortisol was off the chart. So I'm speculating, and the lab actually speculated too, is just because of the amount of training that I do, that's why that was elevated. So I need to do some things to protect myself. So then we look at really the breakdown of the hormones here. Now, this is a complex picture, but if you look there at the top, pregnenolone, that's a precursor to the hormones there. And then the left side, the top, is progesterone. Now, it's an average they look in there. They don't necessarily test for excuse me, progesterone itself, but my progesterone levels are pretty good, 99 for the beta and 52 for the alpha. So my progesterone actually looks really good. That's good. If that was really low, then I would be concerned, because that's maybe why my body's not adapting very well to that cortisol use, but I'm actually doing pretty good there. If we go to that next one to the right there, the DHEA, again, DHEA-S, so I was about 508, which is really good. Good range there for myself. The testosterone production itself was about 41. That's good. If we break down, follow that little dotted line to androstenedione, you look at the testosterones, the 5-alpha and the 5-beta. The 5-alpha form is a really less androgenic testosterone, so it doesn't cause those typical, like, really bad androgenic type things of hair loss or acne or those things. The 5-alpha is the much more potent one, that DHT portion there in the blue. But because I have a pretty good balance of the two, mine isn't that bad there. We weren't too concerned about my levels of testosterone based on what I had going on. So I have pretty good 5-alpha reductase activity, which is good. I don't need to support that at all. So that's really a good thing. So my testosterone actually looked fairly good in this, a little elevated, but not a big deal. Something that we were worried about. If we go to that next one, the estrogen metabolism, here's where it got really interesting for me. The estrone, which is that E1, estradiol E2, and then the estriol E3, I was off the chart on E1 and E2, estrone and estradiol, and getting close to being off the chart for estradiol. So I'm producing a lot of estrogen, which is very interesting. My breakdown, however, we looked at those 16s, those 2s, and those 4s that we talk about quite a bit. My ratio is actually perfect. You want kind of like a 70, 10, 20. I was a 72, 9, and 17. So my ratios of the 2, which is really, we want a lot of 2, really low 4, and really low, and a little lower, or really low 4, but not super low 16 there. My ratios are really good. But again, I'm producing a lot of the E1, which is good, the breakdown of the 2-hydroxy form, but the other levels are kind of going up there too. What that happens there is we look down at the bottom and it goes in, where's methylation there? So I have high methylation going on, but it's actually low activity based on the amount of estrogen I have. So this spurred from here going, maybe I have a potential methylation issue. Let's do that DNA test for the methyl tetrahydrofolate receptors gene, and let's see, or reductase genes, and let's see if we can see if genetics is playing a role here that's really bumping up those estrogen levels, because I can't clear the estrogen out. So I'm doing that test right now. We're waiting to see what that comes back as, and then I'll update you as it goes. But this is an interesting thing that it just showed I'm producing a lot of estrogen. That's why I can't lose the body fat, because estrogen's fat protective. So what I'm doing here is I'm actually taking some estrogen blockers, herbs that help to block my estrogen production, and actually feel better. I feel like I'm less puffy. I feel like my body fat's coming down a little bit, and it's only been about a month or so since I started doing this. So just in that short amount of time, just doing that alone, I'm going to run this for about 6 months and then retest myself to see where I am by taking the herbs to see if that changes my estrogen levels from there. It's a good one here that we can see, because we can follow the estrogen metabolism and go, yeah, we may have some methylation issues, which we do, and then decide, let's run that DNA test now, the genetic testing, to really see, do we have methylation issues? And then further on, do we have the COMT gene that could be causing the same type thing? It's some genetic testing we're getting into, because now we can actually see metabolically what's going on if we have those gene descriptions going on causing the problem there. And then finally here, this is just looking at DHEA production again, and melatonin. My melatonin was good. That cortisol metabolism was off the chart there. But you can see at the bottom there, my daily free cortisol was really good, and my daily free cortisone was really good. And I was actually, because of the amount of work I do and the amount of exercise and everything else, that's why I'm really skewed to that side. That's causing that overuse or over degradation of the cortisol in the system. So I'm doing a couple things also there to help maybe calm that system down there, give my body a little more support with the stress from the workout that I do. So I just wanted to share with you guys that, Pamela and I do these tests on ourselves, so we know how to better help you as patients from them, and then also help ourselves too, because, we're not perfect in any way. We have issues going on, and this showed I have some issues that I didn't even know about or was aware about, but explains why I have an issue with losing body fat. Thanks again. This was Dr. Jerry Bailey, and we'll talk to you guys soon.